Good day, I'm Celeste Mahadir Singh and I'm going to talk about patient care and communication in nursing. Anyone can listen to this video from the ages of 10 to 60 while I address the concerns as a student nurse, why it is important to bridge the gap in communication and nursing. Imagine trying to explain to a patient why it is important to take medication but they don't understand. It is important to stay patient, listen, and be attentive while understanding. This speech explores how clarity, cultural sensitivity, and empathy can enhance, the nurse-patient relationship for better progress in treatment. It is important to learn how to communicate with a patient, no matter what age they are. You can use different strategies to do so, depending on the age of the patient, in order to engage the patient. This helps, and it also moves forward with the advocacy of the patient in bringing them to understanding why it is important for the treatment and how we can come together to get it done. According to Norwich University, kindness is one of the top things that bridge the gap in order to get comfort and trust from a patient. A patient wouldn't be able to trust a nurse if they are being brushed off and not heard. Their concerns are important, and having kindness and understanding as a nurse will bridge the gap in having that conversation and trust with the patient. Once trust is established, we can now go on to clarity. Clarity is making a way for the patient to understand the process of where you are coming from and how to go about treating the patient. This also includes why the medication is important, or bringing your knowledge into their understanding in simple ways. Walking through the information step by step is a very important task to make sure that communication is understood between sender and receiver. But even though clarity and empathy is very important, we must take into account cultural diversity. Cultural diversity is understanding the beliefs and religion of the patient. For example, as a Muslim, they would not want any medication with pork or alcohol in them. We must take into account and work around their patient care plan strategically to implement their beliefs. According to National Library of Medicine 2025, gluten and pork-based ingredients are indeed forbidden for a Muslim, and it must be taken into account. It is very serious for them, and we must respect that. There's also another rule in the Muslim religion. Female nurses and doctors must tend to female patients. This is also a belief in their religion and must be respected. This in turn build mutual respect and trust between patient and caretaker or nurse. Even with strong communication skills, we still face some challenges while getting the information to the patient. For example, you're trying to tell the patient about their treatment and medication. However, the hospital is very noisy. The patient can become distracted and they may not understand what the information was because they could not hear what the nurse was saying. Another limitation can be time. We may not have time to explain in depth to the patient what can be done and why medication is important due to it being fast-paced and many intake of patients into the hospital. Language barriers can cause misunderstandings like misinterpretation or mistranslation. And this is very important when dealing with patients that are coming from different countries, and we have to explain a treatment or process or medication to the patient. A patient's emotional and mental state can also hinder communication due to fear and lack of understanding. They may not be able to comprehend at the time what the nurse is trying to convey to them due to the fear and anxiety they are facing based on their illness. The question lies now, how can we overcome these challenges? How can we combat these issues, you may ask? We can use the teach back method, we can be present, and we can even train for patient advocacy. What is the teach back method? The teach back method is allowing the patient to repeat what you just said so you have an understanding that the patient understood, okay, this is the time that I have to take my medication, how many of the tablets they may have to take, and what kind of rest they may need while taking the medication. Being present means to actively and attentively listen to the patient. This way, we can address their concerns accurately. A patient may want to know how their treatment will go along, how long their treatment will be. And to answer these questions, we must be aware and attentive as to what they are asking and to not brush them off. So being present is being reliable to the patient. This is a transactional communication between a nurse and a patient. The sender would like to receive accurate message from the receiver, knowing, okay, they understood what I asked and I got the answer that I was looking for. Finally, we come down to patient advocacy, which is one of the main roles and functions of a nurse. So patient advocacy is ensuring that the patient knows their rights and can choose their preferences and how they can be treated. This brings us back into cultural diversity. They have a right to say, okay, this is my beliefs and I would like to be treated as such. It is also the role of carrying important information such as diagnostics and medication to the patient and explaining thoroughly in a way that they can understand how they can go about this, what is the treatment, walk through, and why it needs to be done. In conclusion, effective communication depends on clarity, empathy, and cultural diversity. We have to be clear on what we are telling the patient, ensure that they understand. We do not need to use big medical jargon to help the patient understand. We have to bring ourselves to their level of understanding and thoroughly walk through with the patient, thoroughly explain to the patient and ensure, okay, they are clear on everything and they agree for us to go forward with the treatment. Empathy and cultural diversity brings trust and respect from the patient that you care and you understand that, okay, they believe in something and we can work around the treatment. So no use of medication with alcohol, no use of medication with gluten or pork. Patients like to be heard and understood, and in order to make sure that they are comfortable and they would be able to cooperate with the treatment, we have to advocate for them, we have to care for them, we have to show them that we understand them and be willing to explain to them about their treatment, diagnostics, and how they can recover. In conclusion, nursing is not just administering care. It's communicating with compassion. It is building relationships with the patient. It's creating understanding as why health is important. and it is building the hearts of the ones who take care of them. Thank you.